I have turned it over
everyone.
to you.
I hope you can hear me okay. Good afternoon. Thank you so much for joining me to review the updated vaccine requirements for childcare in Nevada. Let me go ahead and make sure I'm switching over my slides accordingly. I will be speaking to you about the vaccine required at the minimum recommended age for childcare enrollment here in Nevada. This afternoon, I will provide an overview of how and why supporting immunization management in childcare facilities is so important. I will be reviewing this information as I cover the following objectives. First and foremost, this presentation will serve to educate providers and community members on the updated requirement to vaccinate children in childcare facilities at the minimum recommended age. The minimum recommended age is provided by the Centers for Disease Control and Prevention and the Advisory Committee on Immunization Practices. We will also review a vaccine preventable disease outbreak that took place in Nevada daycares last year. Guidance will be provided on updated vaccine requirement for childcare. And we will also cover the clinical advantages of early vaccination. I will provide you with some community questions and concerns that have been identified within the community since this vaccination update has taken effect. As Brianne had mentioned, we will open this up to questions at the very end, and as she also mentioned, Kathy and Nicole are here with us from the Washoe County Health District to join us for any clinical specific questions that you may have at the end. So moving right along, it is important to identify ways in which we can support immunization management in childcare facilities. These following here listed represent just a few ways that we can do so. It is important to review immunization records regularly to ensure that each child is up to date on their vaccination and to take note of when a child may be coming due for their next dose. It is important to ensure you are aware of the vaccination status of yourself and those working with children, especially those working with infants or high-risk children that may be more susceptible to disease transmission. Also, it's important to educate parents and help them to connect to credible resources. Parent education is important to promote an understanding of the vaccination schedules, the risks and responsibilities should they choose not to vaccinate, and the Nevada state laws and county-specific regulations that are in place to protect child care programs from vaccine-preventable disease outbreaks and transmission. It's important for us working with children attending childcare and schools to become familiarized with the immunization schedule. This is an important resource to ensure children are up to date and we are aware of what they will need in the future to become up to date. Recommended immunizations, they help protect infants and young children from these listed 14 diseases. There are easy to follow children immunization schedules that can be accessed online and available resources that you can get online anywhere, and also there's even a CDC vaccine schedule app. It's downloadable for smartphones, and I like to use it and browse through it anytime I'm working with a schedule, so it's readily at my fingertips. Another helpful resource to assist child care facilities, providers, parents, and guardians in Nevada is the Immunization Information System. Here in Nevada, we have WebIZ. Almost every state has an immunization information system or an immunization registry. So an IAS, just in background, it's a computerized database that can be used to record all immunizations given to children and patients from healthcare providers. In Nevada, child care providers can access WebIZ to see which immunizations children already have and what future vaccines are recommended, which ones have been given validly, and so forth. Nevada WebIZ is a great resource to manage and track immunizations, and I strongly encourage you to familiarize yourself with this tool if you work with immunizations or even if you'd like to manage and stay informed with your own immunizations. If you're interested in getting more information on the Nevada WebIZ, you can look for this at the Nevada Immunization Program website. Ultimately, it is imperative that we stay educated on immunization management. It's important to frequently review the childhood immunization schedule and be aware of any updates or changes that may take place to these vaccine schedules. We should educate ourselves and staff working with children immunizations on the benefits and risks of vaccination, including vaccine-preventable diseases themselves. What are the symptoms of those diseases? What do they look like, and how can we stay prepared? There are some key messages to tell parents, including look at your state's child care vaccination requirements to be admitted into a facility and to also maintain admittance to make sure that we're staying up to date throughout the year. Vaccines protect children from harmful and fatal diseases. Vaccines protect their children as well as also protecting the children around them. There are multiple resources at our fingertips that we can access at all times to stay educated. A few of those are our nonprofit organization, Immunize Nevada, has a plethora of resources that can be accessed. The Nevada State Immunization Program has wonderful resources online as well. Your specific county health district is also a resource that you can look to, and community health nurses in your local area if available. We can fight the good fight all we want, but there are still outbreaks that take place all around us, and there are outbreaks that are taking place in child care centers across the United States. We have seen outbreaks across the, I'm sorry, I'm trying to, my voice keeps cutting in and out. We have been seeing these outbreaks across the U.S. There have been pertussis, measles, chickenpox, just to name a few of them. And we have seen them transmitted, and they have become a full event themselves. Unvaccinated children in your child care center or at home are at risk. Babies may be too young to receive their age-appropriate vaccinations, and they are at high risk. A child that may be unable to be vaccinated due to medical conditions is at high risk. Children who are not caught up on their vaccinations may be excluded from child care when outbreaks occur. It's important to be aware of the state and county child care immunization regulations and guidelines. This segues me right into the next portion of the presentation I wanted to share with you. I wanted to share with you a pertussis outbreak that was identified last year. This impacted daycare centers in Carson City. Just a brief overview of what the case breakdown looked like. It included the following. There were 10 confirmed cases. This impacted 5 different daycare centers and 1 group housing facility. There were 95 close contacts identified, and the age range of these cases were between 3 months and 40 years of age. The information about the outbreak was disseminated to the public through press releases, fact sheets, web resources, and articles, even in the Nevada Appeal. This was an ongoing event that lasted between March 3rd of 2017, when the first community case was identified, through May 22nd of 2017, when the community outbreak was declared over. Some more information, the immunization review results. I've just laid out some background information from the daycares that were visited. The daycares that were visited had an immunization audit, which went through each of the child's vaccine records to verify if that child was up to date and had protection against the recommended vaccines and DTaP for pertussis. So here you see in Daycare 1, there were 66 children's records reviewed. Unfortunately, when we're reviewing these 16 records, it looked like there were 15 children that were not up to date for their age. So that accounted for about 22%. In Daycare 2, was a little bit bigger, so you see that there was 104 children's records reviewed. 30 of those children were not up to date. Approximately, that was about 29% of the children attending. Next, if we go down, we see here in Daycare 3, there were 7 religious exemptions. However, utilizing the Nevada IIS system, WebIZ, 5 other children were identified where 4 of those children were not up to date. So that accounted for about 80% of those kiddos that weren't meeting their vaccine requirements for child care admittance. The lessons learned from this outbreak identified by the Carson City Health and Human Services, it included policy changes that were necessary. We're going to talk a little bit more in depth about this here in a moment. The utilization of WebIZ for vaccination history entry, health officer inclusion and participation to ensure that they know their authority and are able to use it accordingly. strengthen daycare education to provide them with the necessary resources, rapid notifications to the providers and physicians, and vaccination recommendations for responders that may have been exposed during the outbreak. So this leads us to diving a little bit deeper into what the law actually looks like here in Nevada. So the aforementioned outbreak assisted in the development of some policy changes. Before we go into what the policy updates are, I wanted to just give a foundation approach to what the original Nevada revised statutes state for having a child enroll into childcare in Nevada. So according to NRS 432A.231, unless excused because of a religious belief or medical condition, no philosophical conditions at all, a child may not be admitted to any child care facility within the state, including a facility licensed by a county or city, unless the parents of the guardian of the child submit to the operator of the facility a certificate stating that the child has been immunized and has received proper boosters for the immunization for the following diseases. So here you will see in the original NRS we have diphtheria, tetanus, pertussis, polio, rubella, rubiola, and then here if we come to the end you see G. You see such other diseases of the local Board of Health of the State Board of Health may determine. What does that mean? So if we can dive a little bit further into that, we can see moving right along into the Nevada Administrative Code, the NAC. These are the additional diseases that we will be making sure that our children are protected from in child care. So the following diseases here you will see are a supplement in addition to what the list was listed in for NRS. So that is just kind of the background of what the law is itself for child care enrollment in Nevada for licensed facilities. So moving right along, in January 2018, the Nevada State Immunization Program released a technical bulletin on a vaccine requirement update for child care. So in addition to what was stated for NRS and what we saw in NAC, it is now necessary for children being admitted to child care or accommodation facilities in Nevada to receive all required vaccines at the youngest recommended age per the recommendations of the CDC or ACIP. So this technical bulletin was disseminated out across the state to providers, local health districts, daycare facilities to provide them with this information. To dive a little bit deeper into what it means to receive these at the minimum recommended age, this slide kind of gives an overview of the vaccine update with examples. So here we see the 5th dose of DTaP is recommended between 4 and 6 years of age. So as of the date of the bulletin release, the 5th dose of DTaP is now required at age 4 if the child is attending the child care facility or accommodation facility in Nevada. So this, attached to the bulletin, was also a table. So here the table you can see. It is also important to note the asterisks here at the bottom. It's important to note the age required if minimum interval has passed. So you want to make sure that not only this kiddo is getting their vaccine at the earliest recommended age, but also that they are meeting the series completion for their doses. Additionally here, the bottom paragraph here, it's important to note that any child who is behind on Nevada's required immunizations, they must be brought up to date utilizing the ACIP catch-up schedule to continue to attend the child care accommodation facility. So since the update's been in effect, we did have that information be disseminated to the community, and it's been circulating. And with any new update, it's going to take some time to really let it marinate, have that information be implemented completely into the community. So what I wanted to share with you next is there were some challenges that have been presenting themselves in the community since this has been released. It's important to note that with any update, it's going to take some time, and so there were specific concerns and questions identified in Washoe County. The following are: some of the providers were not aware that the new child care regulations took place and that the earliest recommended age was when they needed to vaccinate. Some providers were uncomfortable or refused to administer more than 4 immunizations at one time. Some providers, they didn't like to use combination vaccines. So which increases the number of pokes a child receives. There was also concern from Washoe County stating that DTaP is not recommended until 15 months. Many providers defer some of the 12 to 15-month recommended immunization schedule just to that 15-month scheduled checkup. Some providers were not aware that DTaP could be administered at 12 months of age, which is the minimum recommended age. And this is due as long as there's been that 6 months since the last DTaP dose is administered. So these are just some of the challenges that we're being seen, and there may be more out there. It's just about making sure that we're educating the community accordingly so that we are up to date on the same regulations that are out there now. So some of the clinical advantages that Washoe County helped to share with me when you're vaccinating at the earliest recommended age are children are protected earlier from vaccine-preventable diseases that can spread rapidly in a child care and community setting. Vaccinated children help protect unvaccinated or undervaccinated children, staff, and other persons in the child care setting, which also it promotes herd immunity, the community immunity, so that we are ensuring that ourselves and those around us are protected at the earliest recommended age from vaccine-preventable diseases. So overall, in summary, immunizations, they keep children healthy so that they can spend more time learning, growing, and socializing with their peers. It's important for child care programs and child care providers to make immunization a priority in child care facilities, make sure that they're following the policies, the state policies, the county policies and regulations. Education for staff is important, and parent education is imperative. There are many ways that we can work together to educate parents using resources from CDC, state and local agencies, and other credible organizations, especially making sure that the technical bulletin and the updates are educated throughout the community to the parents, the daycare providers, and also to the providers and physicians that are vaccinating the kiddos themselves. Ultimately, it takes a village to protect our children, families, and communities against vaccine-preventable diseases. So thank you for all of the great work that you do and that you keep doing for the community so that we can keep fighting the good fight. Thank you for everyone that joined us today to learn about child care vaccination updates. This concludes all that I have for the presentation. If Kathy or Nicole had anything supplemental to add for Washoe County specific updates, I'd like to open it up to them.
Thank you so much, Kira. If there are any other questions, we'll offer a little more time to type those in the chat box below. And anything that Kathy and Nicole, if they had to add, would be great. While we're waiting for those questions to be typed in, just a couple of reminders. If you have requested nursing or pharmacy continuing education credits for today's webinar, please make sure you complete the survey, which will pop up on your screen when the webinar is ended, or in the post-webinar email. The email will be sent out by the end of today, and all CEUs will be mailed out within the next week. If you'd like to view or share this webinar, we had quite a few who registered today that we think will plan on doing that. The recording will be available on our website along with information for future webinars. Please visit immunizenevada.org/webinars for those details. And we do have one question that just came in. There was no additional information that Washoe County Health District had to provide at this time. However, one of the questions is how long can child cares give children to receive their immunizations? Should we exclude them as soon as they become non-compliant, or can we give them a warning? And I will go ahead and I've unmuted you, Kira, if you want to address that. Oh, I apologize. Having a little technical difficulties here. Kira?
Hi, can you hear me now?
I can hear you. Yep.
Perfect, perfect. Okay, that is a great question. That's one of the first questions that came to my mind as well. And Washoe County might be able to assist me in answering this as well. As far as the state regulations go, there are no specific timelines. It's going to be to the discretion of the child care facility, but now is the time. If you're seeing, like I had mentioned, if you're routinely looking at these schedules and you're making sure you're aware of who's coming up to date, that's the time to start educating, working with the parents, providing the resources so that they can get up to date, so that that time doesn't pass and it's already like you have not received these vaccines and you must be excluded. While there are the state regulations, there are county-specific regulations. Washoe County has amended some of their regulations specific to their county and the daycares in their facilities. So I wasn't sure if Kathy or Nicole could provide information on that.
I will go ahead and unmute them to see if they have anything specific to Washoe County that they can say. Just a moment. Kathy, do you have anything specific to Washoe County to add to that?
Yes. In Washoe County, they have 30 days to be up to date. After the 30 days, they do need to be excluded.
Okay, perfect. Hopefully that answers.
Yeah, 30 days from the time it was, due. So
okay.
If it's due, yeah, so they have 30 days.
Perfect. Thank you. Okay, so if there was any additional questions, there's one that popped in. There was a question that says my issue is the 12 to month age period. The ACIP doesn't recommend MMRV at 12 months due to the increased risk of seizures. So most of us give 4 vaccines, MMR, varicella, Hep A, and Prevnar. I think you are significantly reducing buy-in even from pro-vaccine parents by increasing the number of shots from 4 to 5 or 6 if you do DTaP. With such low risk of Hib, why not allow it to be given with the CDC recommended range at 15 months? And I will go ahead and unmute Kira at this time to address that question. Kira, do you want to speak to that?
Yeah, I can speak a little bit to that. And also Kathy and Nicole can also assist with any clinical information on that.
Okay, great. Go ahead.
Can you hear me?
Yes.
Okay, great. That's a really great question, and I'm glad you brought that up because the last thing we want to do is have them get poked many times. I'm sitting here looking up at our catch-up immunization schedule for recommended minimum age for dose 1 for MMR, and I'm seeing 12 months. Kathy, Nicole, if you could help me on some of the clinical information, that would be wonderful as well.
I've unmuted you guys. Go ahead.
Okay, MMR and varicella are given at 12 months. The question regarded MMRV ProQuad. There is an increased risk for a febrile seizure at 12 months, but it is not okay to give it at 12 months, reducing one of the pokes. So that is why it's recommended. While Hib is not predominant, up until 1998 we had many children who got Hib. And when you do get Hib, while not all of them died, they have pronounced effects from that. A lot of times mental retardation and symptoms like cerebral palsy. So that is why we do not recommend holding off on that Hib and getting it as soon as possible. I hope that answers your questions.
Okay, great. Any more questions from any of the participants? And if there's anything that specifically we could address to outside of the webinar, we're happy to contact participants directly as well. It looks like that was the last question that came in. That concludes today's NILE webinar. Again, thank you to Kira and Kathy and Nicole, and to those of you who participated. We hope you have a great day. And again, with any questions, please feel free to contact us after the webinar. Thank you.